Hello everyone, welcome to sqadia.com. We are talking about the development of tongue and thyroid. In this section, we'll deal with the clinical correlates of tongue development. This section has been divided into conditions that occur due to failure of the normal process of development of tongue. These are a lot many processes and a lot many conditions. So we'll deal with the conditions one by one and see what happens and how it actually happens. So getting into it, first of all, we have aglossia. So glossia, whenever it comes in a phrase, the glossia stands for tongue. Aglossia is the absence of tongue. So absence of tongue is known as aglossia. In this condition, either the lingual buds were not formed, or the hypobranchial eminence was not formed, or there was no migration of the muscles, or the process in its entirety did not go as planned. Then we have hemiglossia. Now in aglossia you can see there's no tongue in the child's mouth. Tongue is not present as the adult tongue of a human. Now in hemiglossia we have somewhat halvening of the tongue. Hemiglossia is half tongue. Here you can see a small half tongue is present. Only one of the lingual swellings it fails to develop. So in half tongue, one of the lingual swelling it fails to develop. As a result, there is halvening of the tongue. The tongue is not a complete structure. So in microglossia, the tongue is too small. Micro means small, so the tongue is too small. This condition is known as microglossia. So macroglossia is when the tongue is too large, the tongue is protruding out from the mouth, or even when it's in the mouth, you get the feeling of mouth being full all the time. This is known as microglossia. That is macroglossia, that is the tongue is very large. Moving on, we have ankyloglossia. So what is ankyloglossia? So the frenulum of the tongue, it extends to the tip. So this structure is known as the frenulum of the tongue. Frenulum of the tongue connects the tongue to the floor of the mouth. However, in certain conditions like ankyloglossia, this frenulum of the tongue might extend to the tip of the tongue. So the tongue cannot be taken out of the oral cavity. This condition is known as ankyloglossia. Now we have a bifid tongue. Here you can see a bifid tongue. In a bifid tongue, the anterior portion of the tongue splits into two parts. So there are two parts of the anterior portion of the tongue. This is known as a bifid tongue. Now moving on, we have the lingual thyroid. So lingual thyroid, the thyroid gland, it lies within the substance of the tongue. So thyroid tissue is present in tongue either under the mucosa or within the muscles. Here you can see this is the thyroid tissue present. So it is either present under the mucosa or within the musculature of the tongue, hence known as the lingual thyroid. This thyroid might be the only thyroid in the human body, and excision of which is not advisable, as after this after thyroidectomy of this thyroid, the patient might have to undergo lifelong thyroid treatment. Now, fissuring of the tongue. The fissuring of the tongue occurs due to hypertrophy of the lingual papillae. So here you can see these are the lingual papillae. They might get hypertrophied as a result of various infections and develop into fissures. So this was all about this section. In this section, we talked about various developmental anomalies that might occur due to lack of the process of development of tongue going as planned. In the development of tongue, we saw two lingual swellings and tuberculum impar from the first pharyngeal arch coming together to form the anterior two-thirds of the tongue. The tuberculum impar does not actually contribute to any of the structures of the adult tongue. Then we saw the formation of hypobranchial eminence from the mesenchyme of the third and fourth Pharyngeal arches, this further divided into a cranial part that results in the formation of the posterior one third of the tongue, and posterior most part, the caudal part, which helps in the formation of the posterior most part of the tongue. So if there's any developmental abnormality in any of these processes, it may result in abnormality of tongue development. I hope you understood it. For further such sections, keep watching sqadia.com.